Now, let us proceed to the action of calcium channel blockers. Most clinical ventricular arrhythmias are neither prevented nor suppressed by calcium channel blockers. Calcium channel blockers are useful in treating arrhythmias involving reentry within the AV node. Many of the calcium channel blockers also have the ability to block sodium channels, probably due to the similarity in their amino acid sequences. Calcium channel blockade is enhanced by verapamil and to lesser extent by diltiazem, as the frequency of depolarization is increased. Diltiazem is used for SVTs or supraventricular tachycardia and hypertension. If you want to treat your dog with this drug, you can give 0.125 to 0.35 milligrams per kilogram intravenously. When treating chronic management, you can give 0.5 to 1.5 milligrams per kilogram orally every 8 hours. For cats, you can give 0.5 to 1 milligram per kilogram orally. And for hypertrophic cardiomyopathy of ferrets, give them 2 to 7.5 milligrams per kilogram orally twice daily. Verapamil, on the other hand, is used to treat hypertension. Give your dog 0.05 milligrams per kilogram intravenously slowly. Repeat every 5 minutes. Upon administering orally, give 0.5 to 2 milligrams per kilogram every 8 hours. The clinical uses of anti-arrhythmic drugs. For class 1 drugs, quinidine and procainamide are seldom used in arrhythmias now because of their side effects. Disopyramide is used in atrial fibrillation. Lignocaine is used intravenously to treat ventricular tachycardia and prevent ventricular fibrillation. Class 2 drugs. These drugs are used in patients recovering from myocardial infarction. They are also used prophylactically against recurrent tachycardia. Class 3 drugs. These drugs are useful in supraventricular and ventricular arrhythmias. And for class 4 drugs is verapamil. It is used to prevent recurrence of supraventricular tachycardia, to reduce ventricular rate in patients with atrial fibrillations. These drugs are dangerous and ineffective in ventricular arrhythmias. Here are the adverse effects on anti-arrhythmic drugs. One of the most common and serious adverse cardiac effects is proarrhythmia, which can occur in 5 to 20% of patients treated with class 1 and class 3 drugs. For class 1 drugs or the sodium channel blockers, proarrhythmic effect and dose-dependent negative inotropic effect. For subclass 1A, especially quinidine, is the torsa de pointe, meaning twisting of the points. This usually occurs within the first week of therapy. Pre-existing prolonged QT intervals may be indicator of susceptibility, potentiated by bradycardia, and often associated with concurrent electrolyte disturbances like hypokalemia and hypomagnesemia. For subclass 1C is the ventricular tachycardia. For the class 2 drugs or the beta blockers are the sinus bradycardia, atrioventricular block, and depression of left ventricular function. For class 3 drugs or the potassium channel blockers are sinus bradycardia and torsa de pointe. And lastly, the class 4 drugs or calcium channel blockers are atrioventricular block and negative inotropic action.